Just from a high-level standpoint of RFID, the solution we're looking for is a solution that really starts eliminating the human element. Again, Dr. Hannon spoke about barcoding, and a lot of processes are in place today, but there's no standard process that eliminates the errors. One way to eliminate that is with the use of RFID, to eliminate the humans using a barcoding wand. From past experiences, when we're coding, a bleeding, esophageal varices, blood coming out everywhere, that's when the errors happen, when the blood comes in and it's supposed to be 2 doors down, and they put the blood in our room and we wrap it and infuse it, close the wrong unit of blood. That stuff can all be eliminated with RFID because when it goes through that door jamb into that room and it knows patient in room 102 is a B positive blood recipient or type of blood, if O positive goes in that room, alerts can go off before that gets to that patient from that standpoint. So just a high level applications that are using RFID in healthcare space today is asset tracking. One of the largest deployments to date is asset tracking from an ROI in healthcare. Inventory management from the supply chain, as Dr. Hannon mentioned with blood, would greatly improve our supply chain. Par level management, predictive modeling with that on cases that are forthcoming in the week from that standpoint. RFID is used in a lot of hospitals for abduction in pediatrics today. ED elopement, we know when people leave the ERs that were given an RFID tag, or we know that once they reach a certain time frame, alerts can go up chain to alert them to say we need to process these patients quicker because they've been sitting in the ER for an hour and a half. Medication reconciliation. A couple new companies on the West Coast are tagging with partnerships with large pharmaceutical companies, RFID. So it'll be for supply chain, but also when they take that RFID tagged medication or IV drip into the room, again, it knows it's for that right patient from that standpoint. OR utilization is huge from having the right carts and kits there, but also knowing when an OR suite is clean. Right now it's all paper and pencil. And if your OR lead gets distracted in room 1, was cleaned 20 minutes ago, everybody's waiting for that person to tell them that room 1's ready to go. That can all be automated with RFID today. And again, tracking patient status through the workflow in your organizations and staff resources as well. And one of the opportunities that tracking blood can lend itself to is disaster planning. Here in Indiana, we have 10 districts that for our first responders and the abilities to mobilize specific units of blood to certain regions, universal donor types or negative. Instead of tapping one region, say there's an Amtrak train accident in the South Bend, you've got a couple hundred patients there. You don't have to take all the resources out of South Bend hospitals of O negative to reach that. You can pull from region 1 and region 3 or 4. But to have that, you would have a central, again, what we're looking for is a repository database that would know where all types of units are available at any one point in time from that standpoint. So what, again, as an end user, a clinician who's ordered a lot of blood, given a lot of blood, but someone on the hospital operations side who, first and foremost, is trying to alleviate errors, people getting the wrong blood, making sure we have safe product and processes in place to deliver the right blood, and then cost. Cost to the consumers is escalated because of our inefficiencies today in hospitals managing blood. So this would alleviate excess ordering. It would alleviate the waste today, definitely improve patient safety, and then also response time to events and disasters. Big one again is cost to consumers, hospitals and payers, which we're all chasing. And it really would enhance the collaboration for the general consumers and public to see healthcare working together on a local but national level. Thank you.
Thanks, Troy. Thanks, Ken. So, in conclusion, you can see this is a big problem. We are looking for a solution that can help and also tie in and leverage a lot of the technologies that you've heard about today from Andy and others. The electronic medical records that are being deployed are a deep penetration of health information exchange, so how could they help solve this problem? We want to work with governmental agencies like the State Department of Health, Homeland Security for the hospital districts that you just saw. And then no one across the country has really solved this problem. So let's solve it here in Indiana. Thanks.